Hello and welcome back to the Stay Sure Wellbeing YouTube channel. I'm Dr. Dawn Harper and today I'm going to be discussing bone health. Now our bones get stronger and denser through our early years and they're probably at their strongest in our mid to late 20s. They start to naturally thin from around 35 onwards and they can become so thin that even a minor fall could lead to a fracture, most commonly of the wrist or hip. That's a condition called osteoporosis. And it's thought there are around 3 million people in the UK with osteoporosis, most of those postmenopausal women. The reason for that is women are at increased risk partly because our bones are less dense than men to start with, but also because estrogen gives a natural protection to bones. And when women go through the menopause and lose their natural estrogen, the bones start to thin more rapidly, increasing the risk of osteoporosis. Other risk factors include a family history, so well worth finding out if close relatives have had osteoporosis because that would increase your risk. And people who need to take steroids, oral steroids for other conditions are also at increased risk. Now, of course, if you need those steroids, of course you need to take them, but it is worth remembering that if you can keep that dose to a minimum, it will be good for your bone health later in life. But there are other things that we can do regarding our lifestyle to improve our bone health. Now, I'm often talking about weight and it's usually about being overweight, but when it comes to osteoporosis, actually being underweight is a greater risk factor. And I have met several people who, for example, suffered maybe with anorexia younger in life, who then develop osteoporosis because they were too thin for their bones. So we need to aim for a healthy body mass index of between 18.5 and 25. Try not to fall below that 18.5. It's also important that we exercise and we stress those bones. Bones need to be stressed to be healthy. So it's important to get out and about and do some weight-bearing exercise. Now, I'm a keen cyclist, but unfortunately for me, cycling and swimming don't really stress your bones. They're very good for my heart, for example, so I still keep my cycling up. But when we are talking about exercise for our bones, they need to be weight-bearing exercises. That's things like walking, jogging, running, dancing, skipping, even jumping up and down on the spot. And you need to aim for about 30 minutes at least 5 times a week. More if you can, that's great, but that's your bare minimum that you really need to be doing to keep your bones healthy. Unfortunately, if you're a smoker, I'm afraid that will also increase your risk of osteoporosis. So if you need a reason to give up, then there it is. Have that conversation with either your practice nurse or your GP, because there are plenty of smoking cessation services out there to help you to give up. And I'm afraid alcohol is also a bit of a no-no. Drinking to excess will thin your bones, so do try to stick to those recommendations of just 14 units of alcohol a week. Our bones also need a healthy diet. We need a diet rich in calcium and vitamin D. Now, good sources of calcium are things like dairy products, leafy green vegetables, tofu, dried fruit. And good sources of vitamin D are things like oily fish, egg yolks, and liver. But vitamin D also needs some sun exposure. Now, I absolutely don't advocate anybody going out and getting sunburned, but we do need about 15 minutes of exposure onto bare skin without sun protection factor each day in order to activate the vitamin D from our diet and to look after our bones. It actually, especially in England, where and in the winter where unfortunately sunlight is a little scarce sometimes, it's worth considering a vitamin D supplement. And as a postmenopausal woman, I take 10 micrograms of vitamin D every day. If you're unsure about whether your diet is adequate or if you are at increased risk and you may need a little bit of a boost, then have a conversation with either your GP or a dietitian about whether or not you need supplements. And if you fall into a high risk category, it is worth talking to your doctor about whether or not you should have a DEXA scan. Interestingly, osteoporosis doesn't give any symptoms. People often say to people, I'm fine, I haven't got any aches and pains, but your bones can be very thin without any symptoms at all. It's only when you get that fracture, and sometimes even the spine will start to collapse just under your weight because the bones are so thin. You may have seen often older people walking around with a real hunch, and that can be where the bones have just crushed under the weight, and that can be excruciatingly painful. So it's important that we pick up the diagnosis and act before we get to that stage. If you do need a DEXA scan, your GP will probably recommend that you have that every couple of years just to monitor how things are going, and they will talk to you about all of the things that I've just mentioned in terms of the lifestyle changes that you can make to help keep your bones healthy. And some people will need medication to help produce bone strength and bone density. So I hope that's helped. I hope your bones stay healthy, that you stay healthy, and I'll look forward to speaking to you again soon. Take care.